Hi, my name's Evelyn, and I'm an AmeriCorps member serving at Cascadia Behavioral Health as a mental health first aid instructor. May is Mental Health Awareness Month, so we've put together some informational videos inspired by mental health first aid that will help teach you about mental illness and what you can do to support someone who may need help. Today I'll be talking about signs and symptoms that someone may be experiencing a mental illness or a mental health challenge. The reason we're discussing common signs and symptoms is because knowing what kinds of changes to look for can help us identify patterns associated with common mental illnesses in order to reach out and offer help if needed. Mental health professionals, such as psychologists and psychiatrists, are the only people qualified to diagnose a mental illness. We are living through a really unpredictable and stressful time, and for many people that will manifest as anxiety. You will likely notice some behavioral changes in the people around you, and maybe even notice some changes in your own behavior. This doesn't necessarily indicate the onset of mental illness, but it never hurts to reach out and check in on someone if you're concerned. Those changes might be a sign that the person could benefit from your compassion as a friend, even if they're not indicative of a serious problem. Generally, when identifying a mental illness, we are looking for signs of change. Every mental health diagnosis is characterized by different symptoms and signs, and they are also experienced differently by different people. So to keep things simple, we'll mostly talk about the signs and symptoms of anxiety and depression, since these are the two most common mental illnesses, and there is a lot of overlap between their signs and symptoms. And again, to keep things simple, we'll look at symptoms in three categories: physical symptoms, behavioral symptoms, and psychological symptoms. Physical symptoms for different mental illnesses can vary widely, so keep in mind that this list isn't exhaustive. People experiencing depression or anxiety are likely to experience some physical changes. People experiencing anxiety might also have muscle and joint tension, especially in the back, neck, shoulders, and jaw. An onset of acute anxiety or a panic attack will likely be accompanied with physical symptoms like a pounding heart, shallow or rapid breathing, sudden chest pain, stomach pain or gastric distress, and shaking or tremors. Behavioral changes for mental illnesses will be very different from person to person as well. Pay close attention to changes in the way a person usually behaves, as this can be an indication of the early stages of a mental health challenge. Changes in sleep are common. Some people get too much sleep, others have insomnia. Appetite changes are common too. Some people eat more, some less, and that can lead to eventual weight gain or loss. Becoming isolated or withdrawn is common in both depression and anxiety. Finally, an increase in drug or alcohol use can also be a symptom of an underlying mental health problem. Some symptoms specific to depression include having a hard time attending to personal and work responsibilities, less care for hygiene and personal appearance, lower sex drive, and crying spells. Some symptoms specific to anxiety include avoidant behavior, obsessive or compulsive behavior, and distress in social situations. The final category, psychological symptoms, contains changes in feelings, thoughts, and moods. Again, these will vary from person to person. Feelings common in depression and anxiety include guilt, anger, sadness, helplessness, hopelessness, isolation, irritability, fear, anxiety, and worry. People experiencing depression are also prone to self-criticism and self-blame, mood swings, and the belief that others see them in a negative light. Depression and anxiety can also affect memory and concentration, and increase indecisiveness and a sense of confusion. The feelings and thoughts in the last section are probably all familiar to you. Who hasn't felt stressed out, sad, or angry before? The psychological symptoms of mental illnesses are all normal parts of the human experience. However, people with mental illness may experience periods when these feelings and thoughts become so frequent or so intense that they can impact their ability to work, maintain relationships, and attend to the daily activities of their lives. Some people who experience a period of anxiety, depression, or another mental illness may begin to have thoughts of suicide. In the next section, I'm going to briefly discuss some warning signs that may indicate that someone is having suicidal thoughts. If you're sensitive to this topic but would still like to learn more about resources for how to help someone who may be experiencing suicidal thoughts, please check out the resources video in this series. There are some specific signs to look for that can indicate that a person is contemplating suicide. These may or may not appear alongside the signs and symptoms we just went over, so again, pay attention to changes. Behavioral changes could include dramatic changes in mood, increased use of drugs or alcohol, taking more risks, withdrawing from friends, family, or society, or giving away possessions. You might notice that someone is talking more about death, dying, or the afterlife, or talking about acquiring a gun or other lethal means. They might also talk about feeling hopeless or desperate, feeling worthless, feeling trapped, or feeling like they have a lack of purpose or direction. If you're worried about someone you know, or if you know someone who is exhibiting any of the previous signs, reach out and check in with them. It can be hard to know how to reach out to someone who is experiencing a mental health challenge, but there's a lot of information out there about how to help. If you're unsure about how to reach out, check out the videos in this series about how to help someone in crisis and resources. Thank you for watching.